We have lost the first Wahine Māori chair of the New Zealand Medical Council, Dr. Rachel Love. She will not be reappointed by Minister Simeon Brown to head the New Zealand Medical Council because he says that the council has become too ideologically driven when they've put out statements of support for cultural safety and Hauora Māori standards. And cultural safety is well known and evidence-based. Unions are up in a roar as well. And tomorrow we have scrutiny with the Minister of Health where we will be asking the hard questions. Stay in your lane, Minister.
How does the government give effect to te tiriti o Waitangi in the current health system, considering the disestablishment of Te Ako Whaiora and the relegation of iwi Māori partnership boards in the system?
Well, we are focused on making sure that all New Zealanders have access to timely, quality access to healthcare. That's why we've reinstated the health targets, because we want to make sure that the system is focused on patients, focused on improving access for all New Zealanders, regardless of their ethnicity.
And so that's
what we as a government have done. We've implemented the health targets. We're now focusing resource to where it makes the biggest difference. And an example of that is our immunising our tamariki program, which is something which is put in place by this government, which is working with Hauora Māori providers who work with their communities to improve immunisation rates, which we're now seeing good progress.
And so does the Minister believe that Māori have equal health outcomes to non-Māori?
If you look at just immunisation rates for our 2-year-olds, it's very clear from the evidence that Māori populations have a lower immunisation rate than non-Māori populations, which means we have work to do. And that's why we are improving, and we're investing in Hauora Māori partners who work with Māori communities, who know their communities, and who we're seeing some good results from. So there's a number of things that we're doing to make sure that we improve access and improve outcomes across the board for all New Zealanders.
Minister, news is out that you've decided not to reappoint Dr. Rachel Love and Simon Watt as the leadership of the New Zealand Medical Council. There's been an allergic reaction from health leadership across the sector, where you had said publicly that they are pushing an ideological agenda. Health and wellbeing, these regulatory bodies set standards that are evidence-based, and you're alleging that somehow cultural safety and prioritising Hauora Māori is some ideological agenda. How can that be when this body has been there and doing the work based on the profession and the standards of care for all New Zealanders?
Yeah, I think that question's, a bit further outside of the estimates, but I'm happy to answer the question if the chair allows effectively.
It impacts patient care.
Yeah, sure. Look, I'm happy to answer the question. The answer to your question is that, firstly, this is a ministerial appointments. Ministers make ministerial appointments. That's what ministers do. And those decisions are for ministers to make recommendations to Cabinet, and Cabinet then makes decisions. That's what's happened in this case. In terms of the issues, we've been clear as a government, we expect healthcare to be based on patients' need. And there's been, and in my view, and in the government's view, there has been, for the Medical Council, their recent consultation that they put out, there was a significant reaction to it from many parts of the community, including many in the medical workforce. And the focus that we have as a government is for the Medical Council to be focused on improving access, strengthening the workforce, not dismantling systems, which is what was being outlined in that discussion document or in that proposal.
When it comes to a professional body, evidence-based,
and ministers under the law ultimately make appointments, and that is for ministers to make.
Yeah, and the standards being set have been considered and are evidence-based. And ultimately, why is the minister...
Point of order, Hamish Campbell.
Can I just raise Speaking's Rulings 144-1
Yes.
when it kind of comes to the relevance and scope of estimates questions? Questions about policy or recent events that are no way discernible linked to the government's proposed spending plan should be ruled as irrelevant.
So it's the centre of the government's agenda.
No, but the point,
It's
no,
central to
Do you want to
delivery
speak to the
of
point
health
of order?
services.
I'll speak to the point of order.
Dr. Webb.
Chair, that was raised earlier.
Yes.
The minister said, would the chair give me leave? Can I answer the question? The chair said yes. So the question was ruled in order by the chair.
And you're both right. Yes, it's outside of the scope, and the minister did mention that, but he then also did say that he was happy to answer the question. And so he is answering the question. So you can have one more on it and then we'll move on, because I know other members have.
No, yeah.
Oh,
I would like a
Dr.
supplementary
Gerald
on that
has
question.
something as well.
After you.
Yeah, no, Katie Pye, you take the ones up.
Minister, you have been reported that you didn't just make a decision. You made a decision based on the Medical Council's work on cultural safety. Why are you better able to make a decision on how patients and their culture should be respected than the members of the Medical Council?
Our ministers make decisions every day on ministerial
Yeah, well, take some
appointments.
responsibility for one.
I've taken responsibility for this decision. I made this decision. Recommendation was put. We made a decision as a cabinet, and we've been very clear about the reasons why.
Oh,
All right,
so- no,
we're
so-
going to move on.
Have a look at this members' expense disclosure for the full year 2025. It's the 4 quarters that were submitted to Parliament by Hūhana Lyndon, New Zealand Green Party member. Just have a look at all these figures. Hūhana Lyndon highlights. New Zealand Green Party list MP only. She was elected to Parliament on the 14th of October 2023. Hūhana Lyndon is a single mother raising 3 daughters. She's associated with the following iwi tribes, and I'll try the pronunciations here. I'll get them wrong, no doubt. No, Ngāti Wai, Ngāti Hini, Ngāti Watu, Fatu, whatever you call that, Waikato, Tainui, and Pari Haraki. Lyndon supports the fake Te Tiriti o Waitangi version of the treaty, not the genuine original version of the Treaty of Waitangi. And surprise, surprise, Hūhana Lyndon introduced a members' bill in January 2026 to entrench the Maori parliamentary seats into law, meaning the seats could only be changed or abolished with a supermajority, typically 75%, rather than a simple majority. Lyndon says the current situation is constitutionally flawed and prejudicial to Maori representation, which of course is total utter garbage. Now consider this. Hūhana Lyndon's expenses are striking. A non-ministerial list MP recording $140,632 in total parliamentary expenses for 2025, with $98,457 of that in domestic air flights. Lyndon's nearly $100,000 in domestic air travel for a single year is an unacceptable burden on taxpayers at a time when New Zealanders are struggling with rising costs, stagnant wages, and shrinking public services.